Welcome back. I'm here in Greenville now with Dr. Cedrek McFadden. We're going to talk a little bit about some of your questions that we've received from some of you. But before we get to those, at 4 o'clock we were talking about plasma and how they're using this with COVID-19. And we forgot to mention how folks can look for places to actually donate plasma, right?
Correct. So all around the country, there are nationwide hospital systems that are invested or involved in projects like this. But if you want to know where can you go to donate and you fit the criteria, you can go to the website. You can go to the National COVID-19 Convalescent Plasma site, and that website is ccpp.org.
Okay.
Or you can contact the American Red Cross.
The American Red Cross.
Yes.
All right, and that's just redcross.org.
Correct.
Let's get to a question from a viewer. Kayla is wondering, I had loss of smell and taste for 2 days. I never developed a cough, but I had a skin rash on my face and arms. She's wondering, did she have a milder form of coronavirus?
So the finding of the loss of smell, the loss of taste was added to the new diagnosis or the new symptoms for COVID-19 several weeks ago. You know, one particular report looked at like maybe 60% of people had some form of a neurologic symptom with their COVID diagnosis. You can certainly have mild disease with these particular symptoms, but just because you have these symptoms without a positive test, I wouldn't hang your hat on it yet. But if you're having symptoms, definitely get tested.
Okay, and we know that they are doing free testing right now at Mount Moriah Baptist Church here in the upstate. Also, another viewer, Joe, wondering, will the rain help slow down the spreading of the coronavirus? We've heard a lot of talk about how the weather can impact this. He's wondering if the rain can help slow down the spreading.
So there are a couple of different ways you can look at that. Okay, so number one, if you think about will the rain get you outdoors or keep you inside? Obviously, within confined spaces, that may increase your contact with other people and may certainly increase the risk. But if you think about the activity that what happens outside, if the rain is washing away something, say, from the playgrounds, that could potentially dilute things, but I wouldn't hang your hat on just the weather alone being, you know, protective or, you know, causing this virus to go away.
Okay, and I'm kind of putting this on you on the moment, though, but I know you've talked about this before. Viewers who might be planning trips to the beach, to the ocean, you're not exactly necessarily completely safe out there. You would think with all that fresh air blowing around.
And the wind, correct.
The wind,
and so distancing is still quite important, and making sure that you're not one on top of another right next to another party from your family. But certainly it's still open right now. Many beaches are deciding to open. But still maintain that distance. And some have actually recommended increasing that distance from instead of just 6, if you're running, you're outside, maybe increasing it to 8, just to increase and take up for the fact of wind and what that may do to you and, you know, exposures.
Okay, Dr. C, thanks so much for joining us once again. Appreciate it, and we'll see you next week.
Yes, thank you.
All right, let's head over to Diane and Malachi now.